If you'd like to be in the healthcare sector, you want to help people, you want to save lives, but you don't want as much patient interaction, medical laboratory science is the field for you. What's up, experts? If you ever watched the TV show Game of Thrones, you probably know this guy. His name is Varys, also known as Master of Whispers, Spider. I don't know why, but that's the case. And I'm going to argue a kingmaker. A kingmaker because Varys was always in the background. He could never be a king. He was always trying to figure out ways to determine how healthy the kingdom was. And then whenever he did his testing, his assessing, and he figured out that the kingdom was in bad condition, he tended to find ways of either advising the king so that the king could be better, or he tried to look for a way to put in a new king. Now, some of the kings were good, some were bad, but that's another story. I'd like to argue that in the healthcare system, medical laboratory scientists are a lot like kingmakers in the sense that they provide the data that's responsible for doctors being able to make 80% of the results they do in medical situations. As a result of that, medical laboratory scientists are extremely important. In this video, we're going to explain what a medical laboratory scientist is, what some of the characteristics you need to have to be a medical laboratory scientist are, and stay tuned till the end because at the end, we're going to talk about the pay and salaries for medical laboratory scientists. I'm going to give you, just in summary, what it's like in the USA and what it's like in Nigeria, and then I'm going to point you to another video in which we did it in more detail. For all that and more, stay tuned. So, welcome to the Raw Diagnostics channel. We discuss everything medical laboratory science. We have a medical laboratory science related interview every Friday, so subscribe if that's something you'd be interested in. And let's go on. Medical laboratory scientists are like the foundation on top of which the bricks are going to be put in order to build the rest of the building. They form a very strong foundation. What do medical laboratory scientists do, really? They are responsible for performing tests in order to identify the cause of the disease in a patient. So they are the foundation, or at least the data they provide is the foundation for further treatments, for assessing and monitoring patients, and also for prevention in some cases of diseases, because there are some tests that are actually predictive. You do them before there's a disease to determine the probabilities of someone getting a disease. So as you see, it's a very important profession in the healthcare system. But at the same time, despite being that important, medical laboratory scientists tend to be in the background. They tend to work in laboratories. So you can sort of say it's a faceless profession. You usually don't see medical laboratory scientists except for very short periods of time. We don't have that much interaction with patients. Usually we're in our laboratories doing our testing. We have limited face time with patients. And that's actually one of the reasons why some people get into medical laboratory science. If you'd like to be in the healthcare sector, you want to help people, you want to save lives, but you don't want as much patient interaction, medical laboratory science is the field for you. Now, what exactly do you need to know to be a good medical laboratory scientist? Well, the very basics would include high school level chemistry, mathematics, physics, and English to actually get in a program and then start studying medical laboratory science. The programs can be either 2-year programs or 4-year programs. And a big portion of those will be based on biology. It's medical laboratory science, so biology is extremely important. Apart from that, some of the skills that you need to be a medical laboratory scientist include that you should be a detail-oriented person. Why? Because you're going to be working, first of all, with tiny quantities of samples. You're also going to need to be very hyper vigilant in order to make sure you don't make errors when doing your testing. You don't want to make any errors while you're in the lab because someone could get seriously hurt. Another characteristic of those who get involved in medical laboratory science is that they should not be afraid of blood. If you're the kind of person who is afraid of blood, who might faint because they've seen blood, you shouldn't get into medical laboratory science because you're probably going to see a whole lot of blood. Apart from that, you might also see some fecal samples, you might see some urine samples. Why? Because if, let's say, someone has diarrhea and you want to figure out what the person has, what's causing the diarrhea, you may need to look inside that sample to see whether there are parasites involved. And that's going to involve, of course, working with a fecal sample. Due to the wide variety of diseases that exist, there's also a wide variety of specialties you can get involved with as a medical laboratory scientist. There's a long list here, and so you have things like microbiology, where you're going to be looking at microbes, tiny organisms that are invisible to the naked eye, but that when you take a microscope, you can actually see. Now, under microbiology, you may go into a couple of different things. You may decide to specialize in mycology, you may decide to specialize in parasitology, in bacteriology, and even in something like virology. Now, apart from microbiology, you could also be involved in histology. Histology is a field where you're sent mostly tissue samples. Let's say someone is suspected of having breast cancer. The sample could be sent to you in the laboratory, a tissue sample which you would have to cut, put under the microscope after treatment to be able to see whether there are any abnormal structures in the breast tissue so that you can send the information to the doctor, and then the doctor can tell the patient whether that patient has a cancer or does not. Preferentially, we hope they don't, but cancer exists. Clinical chemistry is another field you can get involved with. Clinical chemistry is a field where you'd be testing, for example, for glucose to know the sugar levels in someone's bloodstream. It's also a field where you'd be testing for substances like creatinine, a substance that gets elevated when the kidneys start malfunctioning. So instead of the doctor needing to go in and see your kidney, very complicated, well, it's simple. You just take a blood sample, that blood sample is sent to the laboratory, testing is done by medical laboratory scientists, and voila, you know if the person has good kidney function or bad kidney function. Simple, right? You can also get involved as a medical laboratory scientist in hematology, where you'll take someone's blood sample, put it under a microscope, and actually be able to see the cells. And if what you're doing is manual hematology, you'll actually be able to count the individual red blood cells, white blood cells, or platelets that are in that person's blood sample. And then you can tell when the numbers are abnormal or normal. And each of those conditions mean something. In the future, we're going to do some videos in which we'll explain what different numbers might mean, but today is just a summary. You may also get involved in immunohematology. Immunohematology is important for blood transfusion. Whenever you have a patient that has had a really serious accident and may be in need of a blood transfusion, that blood that's going to be donated and given to the patient needs to be tested to ensure that there are no adverse reactions, because if you give the wrong blood type to a patient, that patient may die. So it's a very sensitive and important specialty. And lastly, we also have molecular biology. Now, remember, this list is not exhaustive. There are also a couple others, but today, like I said, it's a summary. Depending on the country you're in, there are different associations that are responsible for determining if you are considered a medical laboratory scientist. As a matter of fact, after you're done with your degree and you get that degree, you still need to get a license in order to be able to work as a medical laboratory scientist. In the USA, the organization in charge of determining whether you are apt to work as a medical laboratory scientist is the American Society for Clinical Pathologists, while in Nigeria, that society is the Medical Laboratory Science Council of Nigeria. For more information on what they offer, how the exams are administered, please go to their websites. We are going to link to them in the description section. Now, one very important question to keep in mind, whether it's for medical laboratory science or in any other field, to determine if it would be right for you is, would you do this job if no one gave you the time of the day for the rest of your life? Think about that. If the answer is yes, you'd be willing to work in a laboratory, a bit secluded from patients, far away from the patients. If you're the kind of person who doesn't need as much interaction with people, then medical laboratory science might be for you, especially if you love science, anatomy, physiology, and determining what's happening inside of people's bodies and why they may be ill. Now, finally, as I promised, for those who stay till the end, let's talk a little bit about pay. Payment varies from one place to the other. Even within a single country, you could have a wide variety of payment. Take Nigeria as an example. In the north, what I've been told is you get paid more than when you're in the south. Another example is the US. In the US, depending on the states, you get paid more or less. Taking the median values in those two countries, in the US, you get paid about $56,000 a year, which is actually good. In Nigeria, you get paid as a medical laboratory scientist about ₦1,000,000 a year. That comes down to about 2,600 US dollars a year. There's a very big discrepancy between what you get paid in the US and what you get paid in Nigeria. There are argue that in terms of what you can buy, $2,600 a year in Nigeria is actually not a bad thing. Could be better, but for now, that's what you have to deal with. So if you're in Nigeria, when you get paid, try and ensure that you don't get paid a lot less than that, especially starting out, because it's going to be hard, but still, I think it's possible if you're able to sell yourself. Now, for the past 3 weeks, we've had a form online. We've been asking medical laboratory scientists from around the world to fill that form and to tell us what they get paid in their country in their own currency. And in this video, that's going to show up right there, what we did is we tried to collate all that information, aggregate all that information, do some quick maths, and then made this video to tell you what people get paid in different countries so that you have an idea in case, say, you're trying to move to another country, or in case even within your country you want to know what salaries are, to know how to negotiate your next move. So watch this video. In the meantime, try and get some of this. It never works.